Hello, my name is Casey Reedus. I am a pre-doctoral intern here at the Adolescent Center. I'm going to talk with you a bit about ADHD, which is an acronym that stands for Attention Deficit Hyperactivity Disorder. ADHD is a neurodevelopmental disorder that is often identified, assessed with individuals during their kind of elementary to middle school years, right? Because it's a neurodevelopmental disorder, it is a childhood disorder that tends to transition over into adolescence and adulthood. So when we look at ADHD is broken into three different categories. So we have the inattentive subtype, which we often see individuals who will exhibit difficulties concentrating, procrastinating, often losing and forgetting things, zoning out, daydreaming. Whereas the hyperactivity and the impulsivity subtype, you're going to see individuals engaging in excessive talking, blurting out, interrupting others. Some have even been described as a class clown. And then we also have the combined presentation, which is just a combination of the inattentive and the hyperactivity and impulsivity behaviors combined together. And one thing that we have noticed, because ADHD is a neurodevelopmental disorder that presents throughout childhood, is that it does tend to transition into other areas. And so when we look at individuals and we're identifying symptomology and we're looking to diagnose individuals with ADHD, we have to assess to make sure that it is occurring in multiple settings. So when we are assessing children and adolescents, we often look to see if there's impairments not just in the home setting, but also in the school setting. Whereas if we are assessing adults for ADHD, we want to look at if there's impairments in the home, as well as get background information as if there was difficulties in school, and then if there's difficulties within employment areas. And so we also notice within the clinical field with ADHD is that males are often identified a little early on in comparison to females, because males often will present with that impulsivity and hyperactive behaviors. Those external behaviors makes it more prevalent to where teachers and parents tend to have concerns about the negative behaviors that they're engaging in. Whereas females are often misdiagnosed or undiagnosed due to the inattentive subtype of the daydreaming, procrastinating, not paying attention to details. And females often will exhibit symptomology kind of associated with depression and anxiety. So it'll tend to look, the ADHD inattentive will look like depression and anxiety for females, which is why they often go miss or undiagnosed into their adult years. And once we hit those adult years, then at that point we have to, as always, get collateral information to really fully assess if the individual is experiencing symptomology associated with ADHD. Once an individual is diagnosed and treatment, there are different forms of treatment, and oftentimes you may see children and adolescents being prescribed with psychotropic medications, and even adults at time. Or there's also different forms of strategies and interventions that can be utilized to help an individual be able to function appropriately with ADHD. And so some of those may be receiving classroom accommodations. Maybe you have a student, a child, that needs to sit closer in the classroom or sit closer to the teacher. Maybe we have to work on limiting those distractions. Maybe we have to work on developing different schedules for the individual so that they can remember everything that they're supposed to do in a day versus them forgetting. For more information related to ADHD, please feel free to go to the website, the Monarch